早晨，夠人嚟都夠鐘啦。
Good morning. This is the appointed time. We have a quorum. This is the panel on welfare services. Information papers issued since the last meeting. That's the first item on the agenda. No information paper. Next item. Items for discussion at the next meeting. Would members please note that the next regular meeting is scheduled for the 12th of March, 10:45 in Conference Room 3. There are 3 items for the discussion at the next meeting. First, follow up on the Law Reform Commission report on child custody and access and related support measures. Second, implementation arrangements for the Fujian scheme. And third, review of poverty line. Do members agree to the 3 items to be discussed? If there are no comments, then that will be the 3 items at the March meeting. Next item, report on the Joint Subcommittee on Long-Term Care Policy and priority allocation of a debate slot to the chairman of the Joint Subcommittee. Would members please note the paper prepared by the Joint Subcommittee on Long-Term Care Policy. And would members please endorse the Joint Subcommittee's request to ask for the House Committee's permission for a priority allocation of a debate slot to the Joint Subcommittee so that we can proceed to a motion debate on the report on the 11th of April 2018. However, for a member's motion without binding effect originally to be dealt with on the 7th of February 2018, as it could not be dealt with and should be postponed later, the motion on the Joint Committee's report will also be postponed from the 11th of April to the 9th of May Council meeting. The Joint Committee has also proposed that apart from a debate on that motion, there should also be another debate on a member's motion without binding effect. Would members consider the Joint Subcommittee's proposal? I see that there is support here, so that's it. Next item. Pilot scheme on on-site preschool rehabilitation services. Let's invite the administration in. And I'd also like to remind members that this is the first meeting of the Collocation Arrangements Subcommittee. At 10:45 they will elect chairman. I'm going to take a break between 10:45 and 11. I'll suspend the meeting. In relation to the pilot scheme on on-site preschool rehabilitation services, we have from the administration Dr. Law Chi Kwong, Secretary of Labour and Welfare, Mr. David Leung, Commissioner for Rehabilitation, Mr. Fong Kai Leung, Assistant Director of Social Welfare, and Mrs. Chan Siu Suk Fun, Principal Assistant Secretary, Kindergarten Education of the Education Bureau. Dr. Verana Lau, Principal Education Officer, also from the Education Bureau, and Dr. Florence Lee, Consultant Pediatrician from the Department of Health. So we'll discuss this item till 10:55, but like I said, at 10:45, I'm going to suspend the meeting so that we can take part in the election of chairman for the Committee on Collocation Arrangement. So over to you, Secretary. Please walk us through the paper. Chairman, I'll be brief. Now, members may be aware that at present the Social Welfare Department provides government-subvented preschool rehabilitation services for children through Early Education and Training Center, Integrated Program in Kindergarten cum Child Care Center, and Special Child Care Center. In 2015, we launched the pilot scheme in phases through 16 non-governmental organizations We offer around 3,000 on-site preschool rehabilitation service places that participate in kindergartens and kindergarten childcare centers. We're going to increase the places to 7,000 in 2 years. As mentioned in the policy address, we're going to regularize the pilot scheme. And also, as mentioned in the policy address, our objective is to have zero waiting time for preschool rehabilitation service. However, in the course of implementing the pilot scheme, Chairman, the labeling effect or stigmatization was minimized, and then parents and preschool teachers agree that more children should be subject to assessment. And in our evaluative study, we find that the number of target students may increase. Whether 7,000 places would be sufficient, we'll keep in view. But in fact, the student numbers vary every year. So in terms of regularizing the scheme and implementing zero waiting time for the preschool rehabilitation service, we will closely monitor the progress. As for details that are set out in the paper, I'm going to skip it, and I'll be happy to take questions from members. Zero waiting time, regularization. These are nice things to say. I'll open the floor for members to ask questions. Mr. Poon Siu Ping would like to ask questions. And also Dr. Fernando Zhang. Mr. Poon Siu Ping, 4 minutes. Thank you, Chairman. Of course, we welcome more places. In 2015, we had 3,000 places with a funding of $422 million. And we're going to spend $460 million for 7,000 places. So 4,000 places more with just a slight increase in the amount of funding. I'd like to have some details. And in paragraph 5 of the paper, we have around 8,000 children on the waiting list. Our chairman said that it depends on the progress, but why 7,000 instead of 8,000? Because the waiting time on average is some 13.5 to 18.2 months. And how would the waiting time be improved if the number of places are increased to 7,000? You have 16 NGOs taking up 7,000 places. Are you going to use the same NGOs, or are you going to engage more? What about the total manpower engaged? Do you think that it would can cope with the increased number of places? Secretary, let me start with some of the questions, and then I'll defer to the Commissioner to take the rest. As I understand, the bottleneck of this service has to do with allied health professionals. We have physiotherapists, occupational therapists. For these sectors, they experience severe shortage. That is why we need to increase the number of places in phases from 3,000 to 5,000, 5,000 to 7,000, etc. because of that. And if we are to increase the places from 7,000 to 8,000, we need the supporting resources. It is, however, very difficult to achieve zero waiting time instantly. Well, resources is not the primary factor. The point is we need to engage sufficient professionals in the healthcare teams. Well, if I understand correctly, in terms of manpower resources, the number of places increased would represent a substantial increase as well. But at the same time, we have other forms of services, elderly care, other healthcare services. They're all competing for the same professionals. So we need to implement it in phases, do things step by step. For preschool children, we understand that they are at a peak, and in 2018, for the upper class of kindergarten, they will be promoted to primary school, so the number of preschool children will drop. But these are just projections. As for $460 million, I'll defer to the Commissioner to take your question. Commissioner, I'd like to supplement. In paragraph 3, we refer to the $422 million from the Lotteries Fund, and that's the funding to support the 2-year pilot scheme. That's about $200 million per year. So the comparison is $200 million compared to $460 million. Mr. Poon, you'd like to follow up on the answers? Now, a further point is this: 2 years, $200 million each. But now, with a substantial increase in number of places, you only have $200 million more. I don't quite understand how you deal with the manpower issue, because you have 4,000 more places. If you, do you base your calculation on 2,000 places per year? During the pilot scheme, we spent $200 million a year. Now we spend $400 million a year. So that's double the figure. The member also asked about the waiting time, 13.5 to 18.2 months. After the increase in number of places, do you expect the waiting time to be shortened? And will the 16 NGOs be engaged?
So, allow me to talk about the waiting time. In paragraph 5, the paper talks about the average waiting time. It ranges between 13.5 to 18.2 months. On page 3, we also have another statistic. Compared to 2 years ago, there were some 7,000 kids in the queue, and we now have 8,000. And the difference now is that the kids in the queue, more than 40% have received support through our pilot scheme. Some 40% have already received their rehabilitation training. So in the coming 2 years, when we enhance the on-site preschool rehabilitation services, then the kids in the queue, while they're in the queue, they have already received their preschool rehabilitation training. Just now, the member asked, in our plan, when we have another extra 2,000 quota, we will invite other experienced NGOs to submit a tender, so we will have more than 16 service providers. Mr. Fernando Cheung. Chairman, of course, this is a virtuous policy. We had a mainstream education work group, and I'm aware that Mrs. Carrie Lam is very concerned about this topic, and she has started this scheme. So I have some questions about, do we provide enough service? It's obvious that it's deficient. The paper says that there are 8,000 people in the queue, and more than 1,600 are in the queue for special education needs. So for these children, the on-site rehabilitation service doesn't assist them because they have more severe obstacles. They need the services of special education kindergartens. We need to have hardware in place, and development here is very slow. So I hope you can step up the work. If we want zero waiting time, we need a combination of hardware and software. I understand there are staff shortfalls, and I know that in the early stages, even if they do have funds, they can't recruit qualified staff. So we need planning for the venue and staff. So this indicates whether it was SWD or Labor Department or Labor Bureau, they have not done their job. If we don't do adequate planning, if we haven't done adequate planning, we would have today's scenarios. So given the review, we see schools don't have space, the children don't have parents or caregivers take them to the venues. Some venues might have better facilities, multi-sensory facilities, and so on. So when you plan these kindergartens and centers, shouldn't the venues have some changes to their facilities? So similarly, in your planning, you need to increase the number of independent training centers so the kids have a chance to receive the service. Otherwise, we keep repeating the same problem. And the provision of service is now provided on site, and I hear from NGOs, especially NGOs that have provided this early service, they feel the school-based model has its merits. So aside from delivering the service, so your future increased quota, will you consider other models of delivery? We talked about having social workers and kindergartens. So if we have a social worker there, then regarding SEN children, there is good communication, and in fact the majority of training should be done by parents rather than relying on the therapist. Otherwise we'll never have enough staff. And lastly, the transition to primary school. We hear from parents that they've received service and finally they're given a life buoy, but when they go to primary school, there's a discontinuity, and Labor and Welfare and Education Bureau, they need to get their heads together and deal with this. Well, I can also give you a very lengthy response. When we talk about early training, special education needs, and kindergartens, that's a planning issue. And in recent years, we have more children. When we had 5-year plans, we could not forecast the increase in demand because we have more children. So when we look at rehabilitation services in recent years, we have been increasing the provision of services. So we need to plan for demand and supply, and we will look at it at the RPP level. Members also talked about training. Some of our tools, if we it would be quite challenging for the therapist to bring the tools to the kindergarten, so they have to conduct the training at the center. So we're looking at how we can help the therapists to do their job. So the kindergarten environment can vary. You understand? Let's give you an example. If we can have parking space, we can provide services that can, but not all kindergartens have parking space where you can allow a vehicle to be parked all day and they can have the kids receive training on the vehicle. So we have to look at the kindergarten come SCN. These are two different models. They each have their pros and cons. We have to review our practice when we regularize this service. So even if they are in the queue for other special services, the parents might feel they might still want to choose on-site services. So we have to accumulate experience and we have to see how we should pursue our policy. I cannot give you a concrete answer today, but we can all discuss our future development. We will conduct this social worker service step by step. Now, regarding the transition to primary schools, I have met with parents and we've talked about the connection to primary school. So, Social Welfare Department and Education Bureau, we don't want to see a break or discontinuity in communication. So we feel we can improve in this area. And then moving on to provision of service, we have to have further follow-up. Okay, you've had 8 minutes. We need to allow other members question time. Mr. Kotwai. Well, first of all, FTU will support the on-site preschool rehabilitation service. We support the pilot program being converted to a regular program. We need more support for parents, but the question now is, do we have sufficient resources and sufficient quota? You said that there are still 8,000 people in the queue, so it seems that the demand should be more than 10,000. So in the coming 2 years, if you only increase the quota from 3,000 to 7,000, well, if the Secretary says that every year they will review and add to the quota, we welcome that. But what is the underlying principle? That is, can you really achieve a zero wait time? People now wait 12 to 18 months. And you can see in PRH, the 3-year pledge cannot be met. The queue gets longer and longer. So for our on-site rehabilitation service, if you want zero waiting time, then there should be some statistics for us to make reference to. Second, regarding the assessment, you said that there are more kids now, the demand will be larger, so now the service is better and more people want to try it. So how much time will we need in assessment? We would like to follow up on that. And third, you say the quota will be increased annually. Well, Dr. Pan said that you do have time to manage manpower. It's not being we're not adding the quota substantially over a short period of time. Well, regarding manpower needs and assessment, this is something we need to do in the coming years. So in this field, how many jobs should be created, and people who provide training and courses, they can plan ahead. Can you give us a heads up? Well, regarding the waiting time, waiting for traditional services, this on-site service is for people in the queue. So Commissioner mentioned that we already have a certain percentage of service recipients. So even for people in the queue today, it doesn't mean they have no services. I'd like you to understand that. So when the quota gets to 7,000, we believe that there will be less people needing the service. So when we adjusted when the scheme was developed and the quota went from 3,000 to 7,000, that was when we started. But as we said, more parents said that their kids might need assessment and SEN, so the figures went up to 8,000 plus. But next year the kindergarten enrollment will come down, so our assessment needs to be continuous. We don't have a timetable and so on. If necessary, we can still add to the 7,000 quota, but of course we need more resources. Regarding manpower needs, when I answered Dr. Pan, I mentioned it's not just this scheme that needs the expertise. We also need these experts in social welfare and medical care, so occupation therapists and physiotherapists. This has to be followed up in FEHD, and I think you understand where the difficulty is. We have different professionals providing different services, so can our Bureau attract them? There are a lot of factors at play, so the best strategy is to go step by step, 3,000, 5,000, 7,000, and if necessary we can add the quota. Chairman, I understand.
But whether we have sufficient courses, should you discuss with the education institutions in advance? Now, we are doing that already. I'll defer to the Commissioner. Now, just now the question was on manpower for the Food and Health Bureau. They have heeded our request and they make preparations in this regard. We understand there is a keen demand for manpower. We are trying to enlist the help of education institutions, and we are collaborating with the Hong Kong Polytechnic University. We're in the third cohort of a master's program for OT. That is for the OT PT first degree holders. They need to go through a full-time 2-year course, and their professional qualifications are recognized. For the third year, the requirement is that they must work in the welfare sector. There will be some 60 students graduating in 2019. We're going to start the fourth cohort in 2019. Until the manpower is relieved, we're going to increase our effort in this regard. For preschool services, speech therapists is also in keen demand. Well, in the past, Hong Kong University supplied 48 places every year. And in recent years, the Education University and the Hong Kong Polytechnic University also provide some 130 students graduating from the master's program every year. And we understand that in recent years, the tight manpower situation for speech therapists have been relieved. Perhaps I can defer to my colleague to supplement the answer. Dr. Fernando Zheng and Mr. Kwok Wai Keung asked about the traditional services. For the increase from 3,000 to 4,000 places, we're talking about on-site preschool rehabilitation places. But in the coming years, we will not relax our effort in providing service in the centers. Let's say for the Special Child Care Center, we're confident that the number of places will be increased by 500. As for the Early Education and Training Center, we're confident that the number of places can be increased to 900, meaning that altogether 1,500 places will be available through these more traditional channels. That is on top of the increase from 3,000 to 7,000 places of on-site services. Well, Director, can you supplement? You mentioned the collaboration between the SWD and the Hong Kong Polytechnic University. What is the role of the SWD? Is it going to operate? Is it going to be operated by the Hong Kong Polytechnic University. It's a self-financed course operated by the Hong Kong Polytechnic University. In terms of collaboration, the school fees will be subsidized, with the undertaking that upon graduation, the student will serve in the sector for 3 years. Well, Chairman, for a bachelor's degree training, it's a 4-year course, and in a triennial plan, we need to plan for the any change in the course. It's much more difficult to increase the number of places against such backdrop. Whereas for the master's program, through this arrangement, we can increase the manpower substantially in the short period of time, and this will be the approach taken by the Labour and Welfare Bureau, so that we can increase manpower supply in the sector. I think this is good. Deputy Chair. Thank you, Chairman. I think the first question to be asked is this. You have been criticized for the long waiting time, and the children might have missed their golden opportunity of being treated. Well, I've heard your answers, but how are you going to catch up with the manpower shortage for the NGOs already providing the service? I understand they say that manpower will be arranged, but for example, a psychologist will need to take care of over 10 schools, and every year we have a dozen education psychologists coming on stream. How are you going to catch up with the target ratio of 1 to 4? And I'd also like to follow up on another point. Child abuse is a recent hot button issue. Will you make any reference to the cases and start providing social worker and counseling service in schools? I just want to follow up on this point. Secretary, for education psychologists, be it education psychologists or clinical psychologists, I understand members are concerned about the training in recent years, and for the triennial plan, starting from the 2019 cohort, the tertiary institutions concerned are going to increase the number of places to cope with the demand, but I'm afraid I cannot answer the member's question on supply and demand because it's actually not under our purview. In terms of manpower planning, etc. For social worker in kindergartens, we are planning for that. We're striving for resources. We hope to implement it in the year 2018-19. But as I mentioned on a public occasion, in 2018, I think after the budget is delivered on the 28th of February, you would understand that we're going to increase very substantially the number of places for social workers. Now, some kindergartens do have social workers, but these kindergartens are in the minority. It's very difficult to implement it in a short period of time because of a surge in the demand for social workers. We also need to provide training, etc. So what we do is to take a gradual approach, and we are still planning what should be given priority. I'd like to follow up on the waiting time, as I mentioned. For speech therapy, for example, there is a golden period, and the average waiting time is now standing at 13.5 to 18.2 months. And you've been criticized. Can you tell us some figures? What should the ideal waiting time be? Let me see if I have the figures at hand, but I hope members will understand that for the waiting time cited in the paper, we're referring to the waiting time for the special childcare centers and the early education training centers. In fact, over 40% of those on the waiting list are already using the on-site service. So even if I give you some figures now, they may not be accurate. I can only say that they are still on the waiting list, but the figures are not really accurate. I just want to express my concern because once they miss the golden period, they will miss the opportunity of receiving therapy. Next, Mr. Leung Chi-Chang, I'd like to remind members that at 10:45, when the co-location meeting is convened, I need to suspend this meeting for 15 minutes. So please observe that, Mr. Leung. I am not going to be long-winded. I'm concerned about this on-site preschool rehabilitation service. This is very good policy. It is also appreciated by many parents. As another member put it, this is a virtuous policy with a lot of beneficiaries. I, however, notice a point. That is, for the transitional arrangements for students from kindergarten to primary schools in paragraph 12b in the paper. We're gradually going to expand the scope of the scheme because of its success. How are you going to make sure the transitional arrangements are properly implemented? As I understand, and I'm not referring to all primary schools, but some primary schools do engage psychologists. I mean, for kindergartens. Well, and then in primary schools, there are a lot more classes. And there is a question on how proper arrangements can be made to follow up on these students, which will be put in different classes. I'm talking about a long-term plan. Let's say if some success has been achieved during the kindergarten stage, so that the needy children received the necessary counseling during the golden period. Then when they're promoted to primary schools, a lot more resources will have to be devoted to help these students. And some primary schools are reluctant, in my experience. There may not be a large number of such students in a primary school, but they may be they may be sent to different classes. So how are you going to make sure that there will be resources available for primary schools? Will there be resources from the Education Bureau? Secretary, I think we can look at Mr. Leung's question at two levels. One is on the operational level of support services, and I've actually answered part of that. Second level, for children with special needs, how are we, well, at the policy level, how are we going to provide training and rehabilitation? For the former, we're discussing with the Education Bureau on transitional arrangements so that, well, because primary schools now have to identify children coming from kindergartens with special needs. But now that these children have been absorbed in our system, what we need is the parents' consent to give information, so that once these children are promoted to primary schools, at their admission, the schools will already know about their training needs. And we hope that the process will be smoother in the future. Second point, for children with special education needs, the Education Bureau at the moment provides resources for primary and secondary schools to take care of the SEN students. And Mr. Leung made a very valid point. Every year, there may be variations in terms of children with special educational needs admitted by schools, and it's somewhat difficult for schools. And some primary and secondary schools may wish to procure services from the private sector, for example, provided by the NGOs. However, these services are not really accessible. In terms of what support can be provided to schools so that they can help children with their training and learning needs, there is another issue. I think it's a two-part issue. One is to help the children on the, management in the classroom and help with their learning needs. For younger children, however, we focus on the personal development aspect, such as speech therapy and motor coordination. So for these children with special needs, the Education Bureau will work with the Labour and Welfare Bureau to see how we can help primary schools and also with the help of NGOs. We're going to explore the issue. We've just started the discussion at this level. In the past, in short, the Education Bureau has provided resources to schools for schools to decide how to help these children. Thank you. So I'm going to suspend the meeting at 10:45, as I said just now. Dr. Fernando Jiang would like to go for a second round. Do you really want to ask a question? If not, I'm going to wrap up this item, and when we come back, we'll move on to the next item, so that the administration won't have to wait here. It's a very simple question, just 1 minute. Education psychologists. The ratio is 1 to 4, 1 psychologist to 4 schools. It was promulgated in the CY Leung era. I'd like to know the timetable from the Education Bureau. When will it be fully implemented? We have 100 schools at the moment. When will you reach a target of 900? Well, it's the Secretary already mentioned that it's under the purview of the Education Bureau. I think it's quicker to have the Electrical Secretariat refer this question to Education Bureau. You're suggesting that we should ask the Bureau themselves? They have a representative from the Education Bureau. Secretary. Dr. Lau, were you able to answer that? Thank you, Chairman. I think, like the Secretary just now said, for the education psychologists, the supply is limited.
So, in the coming 2019-20 triennium, we will consider increasing the quota with the high institutions. So we need, after we have a long-term plan, we will consider the 1 to 4 ratio development, how we can extend it to more schools. We will also consider whether all 900 schools can receive the 1 to 4 ratio, or do we need to focus on the schools with a higher SEN need? We'll consider that. We'll have to talk with the schools regarding supply and fine-tune the 1 to 4 ratio. Well, when we talked about the 1 to 4 ratio, so even if the government doesn't have a response, we will have to follow up. So I have to announce suspension of 15 minutes.